Governor Walker announced on Thursday that he's calling a special session of the legislature to take up several initiatives relating to the state's response to the rollout of Obamacare.
It has become abundantly clear that the rollout of Obamacare is failing, and because of that failure to be at the pace that the President's administration has communicated consistently to this state and to other states across the country, we're going to take decisive action to make sure that the people of this state, particularly people in need, do not fall through the cracks. We saw it again. We've been talking about this for some time. Many of you in the press have asked me about this for some time, about will we consider it. And the point I've made repeatedly is that the federal administration, HHS in particular, had been communicating to our state agencies that they felt confident that the rollout of the exchange was going to be corrected, that it was going to be on par. And as you all reported this week, we see less than 900 individuals signed up in the state of Wisconsin. And so it is clear to me that this rollout is not going to be fully effective by the time the exchanges are up and running, and by the time our expectation would be for a transition.
Walker's proposal will delay the BadgerCare reforms set out in the budget and extend the high-risk plan for 3 months.
We're going to be asking the legislature to act on is two particular changes. One would delay by 3 months. So through March 31st of 2014, we would delay the transition for the implementation of people moving into the health care plans under the exchanges at the federal level here in the state of Wisconsin. The other part of that plan would be to delay by 3 months in the similar pattern, delay the changes and keep intact people who are in our state's high-risk insurance plan, HRSA, the Health Insurance Risk Sharing Plan, so that, again, while there is a transition, and again, when we talked about this during the budget process, I mentioned time and time again, as did members of the legislature, that our intention was that if, for some reason, the federal government pushed off the start and the implementation of the exchanges, that we would accordingly delay or postpone the start of our transition.
The governor made it clear that the disastrous rollout of Obamacare was more proof why Wisconsin should not expand Medicaid.
The failure of the Obamacare rollout is precisely why I didn't take the Medicaid expansion in the first place. Because people, Republican and Democrat alike around the country, people who are taking the Medicaid expansion are depending on the federal government living up to their commitment, a federal government that can't even get a website up and going to get people signed up for Obamacare. I've said time and time again, I'm not going to jeopardize and put at risk the taxpayers of my state for a federal government that cannot balance its budget, a federal government that continues to grow the national debt as well as the deficit, and today, even more so, a federal government that can't even get a basic website up and going that they've known about for several years.
As a part of his proposal, Walker also asked the Obama administration to extend subsidies to health plans on and off the exchange for anyone that qualifies. The governor expects the legislature to act shortly after the Thanksgiving break. For the MacIver Institute, I'm Nick Novak.